tinnitus means something buzzing in your head or in your ear, ringing in your ear. Why my ears are ringing? Most of the cases of tinnitus, ear will be absolutely all right. There's something going wrong in the brain. In a simple way, I can tell you, okay, there is no outside sound, but there's internal chit chat of the brain cells, which is interpreted by the brain as sound only. So, in majority of cases,
I mean, can exposure to loud noises cause tinnitus? And if it's so, how it can be prevented?
so yes, loud noises can definitely make you vulnerable to get tinnitus if you are getting exposed to that sound regularly, like the DJ players. They are like very much vulnerable for this particular problem. Tinnitus leads to lot of anxiety and lot of tension actually, because you know what happens? Tinnitus, people start feeling, I'm going to lose my hearing in the future. I'm a IT guy, 27, 32-year old. My ear is buzzing actually. I think I might get a brain tumor in the future. And then we have got a super doctor on the planet called Dr. Google. The moment you search on that, tinnitus, most important common causes, number one is brain tumor. Number two, you lose your hearing very fast because of that, whatever reason. So tinnitus, in fact, causes a lot of anxiety and a lot of apprehension amongst the patient mind that probably I'll get something very serious or sinister in the future, and this is the first alarming symptom of that. However, let me put that anxiety to rest by saying that that's not the case. That's not the case. Let me take you through what are the various identifiable causes of tinnitus. Number one is simple. You get the ear examination done by the ENT doctor. Number one is wax. Simple wax in the ear can lead to tinnitus. Number one. Number two, let's go to your eardrum or tympanic membrane. You might have a hole in the eardrum, a perforation over there, and there may be some pus coming from the ear. That's called middle ear infection. That is one of the another common cause of tinnitus. These are treatable causes. Then some of the bones in the three bones in the ear to hair, and one of the bone get fixed. That can lead to tinnitus called otosclerosis. Then let's go inner ear. So there are three part of ear: external ear, middle ear, inner ear. In the external ear problem, there can be wax. In the middle ear problem can be eardrum perforation, some infection over there. And the inner ear, the main part which you hear is cochlea. There can be some damage to that part of your ear because of number one, age. The age-related hearing loss, which our grandparents may be having, is called presbyacusis. Now, when age makes the cochlea weaker, cochlea means inner ear weaker, and your brain is not getting too much stimulus of outside sound in a proper way, again your brain cells start chit chatting with each other. If outside, so nobody is coming to really talk to you, you will start chatting. You will, remember, teacher is not there, student chatting with each other. So in your grandparent, cochlea is not working properly. So sound is going lesser, lesser, lesser. So your brain cells start chit chatting, or there can be some damage within the cochlea, within the inner ear. Because of that, the tinnitus can be generated. Then number two, some drugs. People may be taking aspirin for a very long time, and aspirin is a known cause of tinnitus. Though not in the lower doses, but in the higher doses, yes. People may be taking some injections, antibiotic injections, like people take amikacin, gentamicin, streptomycin. These kind of injections, if are given to you, they also damage that part of your inner ear, which can lead to tinnitus. Then the noise itself. Nowadays, a lot of people are using earphones and all that. Loud noise exposure, as you rightly pointed out, that can damage your inner ear, yes. And we must keep in mind the next part is the nerve which connects the inner ear to the brain. We might have some problem called the tumor of that eighth nerve. Yes, that is one thing we always keep in mind. The tumor of that nerve can also be cause of tinnitus. You can ask me, Rajiv, then why my tinnitus is not that tumor then? Because you are saying take this. Then this tinnitus, let's divide into two parts. Tinnitus without any other symptom, like hearing loss, ear discharge, some infection in the ear, anything blockage, no other symptom is there. In that, we don't keep this as a diagnosis over there. If you have a tinnitus with hearing loss, with vertigo problem, the spinning problem, definitely we would recommend you for further investigation over there. So what we do is, Lavanya, we do the basic checkup first. Number one, we rule out the wax and other issues. Then we get the basic hearing test done. It's called audiogram. If your basic hearing test is also normal, it means your only brain cells are chit chatting, nothing to worry over there. If the other result come, your the hearing test shows some problem in your hearing on one side is there, and that's your tinnitus. And this hearing loss is actually due to some problem after the middle ear towards brain side. I would recommend please get an MRI brain done and let us sort it out and let us really give you a reason to feel no anxiety. I've seen my MRI because what is people say do not worry. Actually, I would not believe that enough really practice because if a person has come to me, he must be or she must be losing sleep because of that issue. So I would either investigate clinically and I will say nothing is required. Do not worry. And if I have a doubt with the hearing loss over there with tinnitus, I will say, I think let's take it further now. One other disease I want to tell you, Lavanya, is the tumor of the eighth nerve, a Gaussian neuroma. Very easily, it can be ruled out on MRI brain, and patient would be getting the right kind of message that okay, I do not have anything sinister in my head over there.
Thank you.
Tinnitus can be managed in a proper way, but we cannot uh, totally eradicate tinnitus. We can take your help and we can put our science over there and we can make sure that your life is comfortable and tinnitus stops bothering you. Tinnitus will be there, but tinnitus will not bother you because the moment I say I will stop tinnitus, next time when you go to some resort, it's a pin drop silence there. Even the cricket sound, the jungle sound of that insect, even you will say, Dr. Dhawan, I'm still getting tinnitus over there. So tinnitus cannot be completely obviated. Tinnitus can be clinically managed with the help of the patient and with the scientific induction from our side. Actually, that's what I would really like. As of now, we are there.